So, thank you for the invitation, for the opportunity to speak at this important event. It's nice to be back in Greece. I've been here on an event organized by the Hellenic Cancer Patient Organization in just 2 months before the pandemic started. So, definitely we heard a lot about the Europe's Beating Cancer Plan, and I would like to reflect on its potential impact. It's the first time that the European Union takes action on at the supranational level for a structured and, let's say, infrastructural approach. So we had initiatives on public health because that's usually in the domain of the European Union, of the European Commission, but this time it is something that addresses the infrastructure and the national cancer policies as well. Very importantly, sometimes there was some irony added to the comments, to the initiatives. You are asking us to do a lot of things, but you're not supporting that. But this time, this is not justified because there's so much money, and the Commissioner has alluded to that and reflected on that, and also reflected on the specific initiatives. Obviously, there's even more need for a cancer plan at the national level now. Reasons are very simple. We need to structure processes, activities, and especially patient needs. If we map patient needs across the entire trajectory of cancer, which ranges from promotion, early detection and prevention to palliative care and survivorship challenges, we can then identify also gaps and priorities. There have been delays on early diagnosis, screening, symptom identification, and care in general. Many countries avoided affecting oncology in this sense. And my country, although small, has managed to push through the screening programs to the same level as pre-pandemic. But that required a lot of effort. And there were disruptions of previously normally running services. There were inherited delays and, unfortunately, also waiting lists. There's a question of how do we measure a cancer plan and the tools for doing that. Well, anyone who does project management will tell you that if you don't measure, there's very little point in doing it. And there are a few issues. Realistic objectives, clear targets, not fantasy targets, but ones that can be reached. Priority setting. We cannot do everything in 5 years. We have to push some things for further along the road. Especially identification of gaps. Special stresses on registries, survivorship, and quality in all aspects of cancer control. This cannot be overly stressed. Finally, patient active involvement and participation in all phases of the process. I'm the one who usually promotes how successful the collaboration at the European level in projects and with the support of the European Commission could be. We have run 3 successful joint action programs, and the first one provided a guide for European good quality national cancer control programs. The guide is free to use, and it's very useful as an orientation. We don't call it a template because it's not one. The forthcoming joint action starting next year will further elaborate on the guide. I will just briefly touch upon the topic that we have an expert on here, so I will not try to take the place of Christine, but I think that we have seen so many challenges to health literacy, and some of our old paradigms simply don't work anymore. And we had negationism, fake information, no-vax movements, and we do not want that to contaminate our struggle against cancer. We have to be very careful, and the previous speaker alluded to the ambitions to eliminate cervical cancer, and we need the full collaboration of the populations. We cannot have this big disparity that we have sometimes seen with COVID vaccinations. But we all have to take part in that. Thank you very much.